How come 3 out of 4 men told their prostate cancer is low risk end up needing treatment anyway? I'm Dr. Ajay Bhatnagar, and I've treated over 15,000 men with prostate cancer. What I've seen is that there are things that determine if that happens to you. Here's what they are. Your PSA is higher than it was at your last visit. Your doctor said it's fine. No new biopsy was ordered. Your plan stayed exactly the same. You've probably been told PSA fluctuates and one number doesn't mean much. That's sometimes true. What a rising PSA without a response tells me is that the protocol has drifted into autopilot. PSA is one of the only real signals your body sends during surveillance. When it moves up and nobody asks why, or nobody checks the tissue, that signal is being ignored. PSA velocity matters. A rising number 2 appointments in a row is different from a one-time spike. I've treated patients who came to me frustrated after this exact scenario. Their PSA went up twice in a row. Nobody ordered a biopsy. They were told to come back in 6 months. A PSA that keeps climbing with no new information being ordered means your surveillance isn't surveillance anymore. Think about your last 2 PSA results. Did the number go up? And did anything change in your plan? Hold that answer. If this is landing, subscribe so you don't miss what's coming. There's a lot more on this channel about what the data actually says on prostate cancer treatment. You've been given a treatment recommendation, but you've never seen a single page showing the cure rate and side effect for every option that applies to your case. Most patients take this to mean their doctor selected the best option and the rest aren't worth discussing. What it actually tells me is that a real comparison was never made. You got one lane, not a map. Every major treatment option for localized prostate cancer has published outcome data, cure rates, incontinence rates, impotence rates, recovery time. These numbers exist and they're specific. A patient who's never seen them side by side has no way to know what they traded. Almost every patient I've treated who came from another practice had never seen a comparison chart. They were told what to do. They weren't shown why. You can't make an informed decision about your prostate cancer if you've only been shown one option. You've had a treatment conversation with your doctor. Brachytherapy, the prostate seed implant, was never brought up. You've probably been told your options are surgery, radiation, or monitoring. Most patients assume those are the only real choices. What it tells me is that your doctor likely doesn't perform brachytherapy, and most physicians only discuss what their practice offers. Brachytherapy is a 45-minute outpatient procedure. Patients go home the same day. For low and intermediate prostate cancer, it has a cure rate above 98%. That data has been published for decades. A doctor who doesn't offer it has no financial reason to bring it up. I've had patients come to me after 5 years on active surveillance who had never once heard the word brachytherapy. Their care path had no one who performed it, so it never came up. If your doctor never mentioned brachytherapy, you weren't giving a full picture of your options. Has anyone who treated your prostate cancer ever walked you through how brachytherapy works and whether it fits your case? If not, that's sign 3. The last sign is the one that catches men the most off guard. Most people think it means they're doing fine. Your doctor told you your cancer is low risk. You probably felt relieved, but nobody told you that 75% on active surveillance eventually need active treatment. Most patients take low risk to mean the cancer probably won't need treatment. It feels like a clean bill of health with a footnote. What it actually tells me is that the conversation stopped exactly where it should have started. Low risk describes how the cancer looks right now. It doesn't describe what it does over time. 3 out of 4 men on active surveillance eventually cross into the treatment territory. The label is about grade and stage today. It says nothing about trajectory. Almost every patient I've seen who felt blindsided by a Gleason upgrade or a rising PSA trend said the same thing. Nobody told them that low risk didn't mean probably won't need treatment. Low risk tells you where your cancer is today. It doesn't tell you where it's going. If three or more of these signs fit your situation, you're looking at a pattern. No defined trigger, no response to a rising PSA, no full comparison, no mention of brachytherapy, a label that stopped the conversation early. These signs come from the same place, a practice that tracks your cancer but hasn't built a real plan around your case. I had a patient come to me, 68 years old, 2 years into active surveillance. His PSA had risen 3 appointments in a row. Nobody ordered a biopsy. He'd never heard of brachytherapy. He thought he was being managed well because nobody called to say otherwise. He had the procedure, went home that afternoon, and his cancer's been gone ever since. Write down your answers to the 5 signs before your next appointment. What to bring, the specific signs that apply to you, written in plain language, which ones you could answer and which ones you couldn't. The question, can you show me the exact threshold that would change my surveillance plan? And can we compare brachytherapy to my current options with the outcome numbers? What a good response sounds like. Your doctor answers both questions directly or books a dedicated appointment to walk through the comparison with real data. If the provider dismisses the pattern, ask for a referral to a brachytherapy specialist for a second opinion. Most men on active surveillance aren't being watched carefully. They're just waiting between appointments with no defined plan. Now you know the 5 signs that separate those two things. You know what to ask, and you know what a real answer sounds like. There's already a video on this channel that covers what the data says across every major treatment option and why one of them almost disappeared entirely. It's called After 15,000 Patients, I Changed What I Recommend for Prostate Cancer. Watch that one next.